So for this exercise, you're going to lie on your back with your knees bent, nice and relaxed, and you're going to start to breathe deeply into your lower rib cage. So gently place your hands on the rim of your ribs so you can feel what's happening. For this exercise, we're going to focus on the lower rib cage. So what we want to see is when we breathe in, you want to see that lower rib cage expand outwards. And as we breathe out, that should come back in. Now, if the ribs are moving as described, it's a good sign that the diaphragm is working well as a breathing muscle. Now, when I say movement, I'm only really talking about like an inch on each side. But if you're not feeling much movement, or if the movement is asymmetrical, meaning the left and right kind of move differently, or if the ribs move upward when you breathe in instead of laterally, which is a sign of the ribs flaring, then you really want to work on this exercise. So now you're going to hook your fingers onto that inner rim of your ribs. And as you breathe in, you're going to pull those ribs apart, encouraging that outward expansion of the ribs. Now, if your ribs tend to flare, you can apply downward pressure, meaning pressing down on those ribs instead to encourage that lateral expansion. Now, as we breathe out, this time you want to press from the outside of the ribs inward to encourage the ribs to shrink in size. If you practice this and you start getting it right, you'll feel you'll have less tension in your neck or low back when you try to breathe deeply.